All right, welcome everyone. Today we are going to dive into how artificial intelligence is, well, pretty radically changing the world of radiology. And look, this isn't some far off science fiction concept. This is happening in hospitals right now, and it's fundamentally shifting how we find and diagnose diseases. So let's get right into it.
I want to start with just one number, but it's a really powerful one: 80%. So get this, between 2009 and 2020, the workload for diagnostic imaging shot up by a staggering 80%. But in that same time, the number of radiologists, it only grew by about 2.5%. That gap creates this massive challenge, puts incredible pressure on radiologists, and really sets the stage for where AI can help the most.
So, how exactly is AI stepping in to bridge this gap? Well, here's our game plan. We'll kick things off by digging into the modern imaging challenge. Then we'll see how AI is acting as a partner to clinicians. From there, we'll look at it in practice, weigh the promise against the pitfalls, and finally, take a peek into the future of diagnostics.
Let's start with that modern imaging challenge. You see, this flood of images, it isn't just a logistical headache, it's a cognitive one. When you're pushing through that sheer volume of work, it puts an immense strain on radiologists, which can lead to fatigue and a higher risk of perceptual errors. And that is the exact problem that AI is being built to help solve.
So you might be asking, why radiology? What makes it such a perfect laboratory for AI in medicine? Well, it's really a perfect storm of factors. First, hospitals are sitting on mountains of digital data. We're talking decades of images, all neatly stored in systems called PACS. Second, all that data is standardized in a universal format, DICOM, which makes it incredibly easy for computers to read. Third, the results are measurable. A diagnosis on a scan can be proven right or wrong by something like a biopsy. And finally, the work involves a ton of high-volume repetitive tasks, which is exactly where machine learning just shines.
So how does AI actually fit into this whole environment? It is absolutely critical to understand this one point. The goal here is augmentation, not replacement. You have to think of AI as an incredibly sharp, tireless clinical partner for the human expert. This quote from the Journal of Radiology and Clinical Imaging just captures the idea perfectly. It calls AI a variance reduction tool. So what on earth does that mean? Well, in simple terms, it means the AI helps make sure that the last scan you read at 3 in the morning is interpreted with the same accuracy as the first one you read at 9 a.m. fresh off a cup of coffee. It's all about leveling out performance, reducing the impact of fatigue, and closing the experience gap between different interpreters.
So what does this actually look like in a real-world workflow? Traditionally, studies are read first in, first out. But with AI, the system pre-scans every single study that comes in, so a potential brain bleed doesn't have to wait in line. It gets flagged and bumped to the very top of the list instantly. Then, when the radiologist opens the scan, they aren't starting from scratch. The AI has already pre-marked suspicious areas. It's a true partnership that just makes the whole process faster, safer, and a whole lot smarter.
Okay, so let's move from the how to the what. Let's look at a few concrete examples of AI making a real clinical impact right now, today, across different specialties. We'll start in neurology with one of the most time-sensitive diagnoses in all of medicine, detecting an intracranial hemorrhage, basically a bleed in the brain on a non-contrast head CT. In these cases, every single minute matters. And here, you can see it in action. This is a head CT where an AI system has automatically identified and outlined a potential bleed in green. This really functions as an invaluable second set of eyes, flagging a finding that could be super subtle and easily missed, especially during a busy overnight shift in the ER. Now, this isn't just about finding things. It's about getting patients treated faster. A landmark study published in JAMA Neurology looked at the Viz AI platform, which automatically analyzes scans for stroke, and the results were just astounding. It cut the average door-to-treatment time by 52 minutes. That's nearly an hour of saved brain tissue, which, as you know, can be the difference between a full recovery and a permanent disability. Okay, let's shift gears to another critical, high-volume area, breast cancer screening. In mammography, radiologists interpret thousands upon thousands of images to find the absolute earliest, most treatable signs of cancer. It's an incredibly demanding task with huge implications for patient outcomes. And the evidence here is just so powerful. A major study from Google Health, which was published in Nature, found their AI could do two incredible things at the same time. It reduced false negatives, meaning it caught cancers that were initially missed, but it also reduced false positives.
That means fewer women were called back for stressful, anxiety-inducing, and ultimately unnecessary follow-up tests. So it's not just more accurate, it's actually more humane.
And for our third example, let's look at lung cancer screening. The job here is to identify these tiny, potentially cancerous nodules on chest CT scans. It is a classic needle-in-a-haystack perceptual challenge, and it's absolutely vital for catching lung cancer early when it's most treatable. And as you can see from this chart, deep learning models are exceptionally good at this. Studies have shown performance well over 90%. High sensitivity, remember, means the AI is great at finding the nodules that are there. And high specificity means it's great at correctly identifying scans that are clear, which prevents a lot of false alarms. It just ensures the right patients get the follow-up they need without overwhelming the system. Now, as exciting as all these examples are, we have to talk about the pitfalls. It is absolutely essential for you as future clinicians to have a really balanced, realistic view of this technology's promise and its challenges. So let's talk about a crucial concept called variance compression. Honestly, this might be the single most important term in this whole discussion. The real power of AI in practice isn't necessarily about outperforming a top expert on their best day. It's about raising the diagnostic floor for everyone. It's about reducing those errors related to fatigue and narrowing the performance gap between trainees and seasoned experts. It makes performance more consistent and reliable for every single patient. But, and this is a big but, we have to be keenly aware of the limitations. Dataset bias is a huge one. If a model is only trained on images from one population, it might fail completely in others. Generalizability is another problem. An algorithm trained on Siemens scanners may not work as well on GE scanners. And then there's something called automation bias, the very real risk of becoming too reliant on the AI and missing its mistakes. And this is why human, expert radiologist oversight remains the ultimate, non-negotiable safety net. So where is all of this heading? And maybe more importantly, what does this all mean for you as you prepare to enter your clinical careers? Well, we are witnessing a really rapid evolution. We're moving from AI as just a simple supportive adjunct, a little pop-up that says, hey, look over here, to a deeply integrated infrastructure. It's actually becoming part of the hospital's operating system, involved in everything from optimizing the scan itself to prioritizing the entire work list, and even helping draft the final report. And this brings us to what I think is the most important takeaway for you. Your job isn't to become an AI developer. Your job is to be an informed clinical user. And what that means is understanding how these tools work, knowing their limitations, and being able to apply them critically and responsibly to give your patients the absolute best care possible. So as we wrap up, I want to leave you with this question to carry with you not just through your training, but into your careers. Technology is not the destination, it's a vehicle. The real question is, how will you choose to drive it? Thank you.